those two things together. My mom just called me. Okay, I don't know where we were, but this is the answer. They want to protect everyone. Public health, safety, and welfare. We want our people to be okay, we want our nurses to be okay, and we want our patients to be okay. A nurse's license is suspended by the state board. Which statement is true? The nurse can continue to practice with a preceptor. Suspension means no practice until reinstated. Suspension is permanently revokes license. Suspension is the same thing as reprobation. Well, I don't know about you, but I have been suspended in school and out of school when I was 15 to 18 years old. Maybe even 14. No, I was 15. So, put it in that terms. If you're suspended from school, can you go to school? Okay, let me rephrase that. If you have OSS, out of school suspension, can you go to school? Property. No, you can't. So the nurse may continue to practice with a preceptor. No, she's suspended. Or he. We're not judging. Suspension means no practice unless reinstated. Maybe. Suspension permanently revokes the license. Okay, well, if I'm suspended from school, I have OSS. Is that being expelled? No. So, boom, no. Suspension is the same thing as probation. Put it in terms of school. If you have so many absences and they say, you're going to get suspended and your probation, we're not going to give you out of school suspension, we're just going to give you in school suspension unless you keep doing it, then we'll escalate. That would be probation. So, suspension means no practice unless reinstated. I hope that makes sense. It makes lots of sense to me. Which statement best differentiates licensure from certification? Licensure is optional. Certification is required of all RNs. Licensure is required for entry to practice. Certifications validates specialty / APRN competence. Both are optional. Certification is required before NCLEX. Okay, break it down. I'm pointing with my finger, not my mouse. Certification is required for NCLEX. How can you be certified in shit before you take the NCLEX? No, that's not how that works. Both are optional. Do you look at this and think, yep, these two things are probably optional? No. Licensure is optional. Certification is required of all RNs. Yes. I'm sorry, not yes. This is like one of those questions where you have to know the information. You can't just kind of figure it out. But you can use it to be like, okay, well, what's licensing? Licensing is basically, okay, I have graduated school, I have passed the NCLEX, I can now practice as a nurse. Certification is higher education or certifications in like different things. So like APRN, I don't think APRN and masters are the same thing, but you could just associate the two. APRN is higher education. It is the graduate school, the graduate program that's on the 3rd floor while we're all on the 2nd floor. So, licensure is required for entry. Yes, certification is for whatever the fuck that says. Okay, provisions. Which provision aligns with protecting the patient's rights, health, and safety? I wish I had my list. I'm not even going to find it. I'm just going to tell you it's provision 3. Memorize it. Know that. Provision 3. Okay, do we really have to do this? Which sequence reflects the standard of nursing practice? I don't know. A, D, pi. Clearly. Okay. This one, whatever. Select all that are standards of professional performance. Evidence-based practice and research, communication, outcome identifications, leadership, environmental health. Okay, well, which one of these things is not like the other that we can knock out right now? Outcome identifications. That's AD-PI. That is the planning / outcomes of AD-PI, so we know that that one's not it. This is the answer. Evidence-based practice and research. Communication is also the answer. Leadership is also the answer. And environmental health is also the answer. Let's see the rationale as to why. It was really loud in my ear. Professional performance includes ethics, current culturally congruent practices, communications, collaborations, leadership, education, evidence-based research, quality, evaluation, resource utilization, environmental health. So, what we can deduce from here is that the standard of professional performance are all the qualities that you would like to have in a nurse. You want them to be ethical. You want them to have culturally congruent practices. You want them to have communication skills. They should be collaborative. They need to be leaders. They have ability to educate. The information that they have is good information. It is evidence-based information. Their quality is good. They're able to evaluate resource utilization. They use their resources. Environmental health. I'm not really sure. They want the world to be healthy. I'm just talking out my ass here, but that's a good way to remember it. Which are the appropriate sources for evidence-based nursing practices? Okay, think back to school when you were learning how to write an essay and they said, what website do you not use? I'm asking you this. You're right, Wikipedia. So which of these things are going to be when you go into your school's database and they say you can use this, this, and this? Can you use agency policy and procedure, read it yourself. Yes. Peer-reviewed journal articles. I don't know about you, but that's all I had to use in high school and college when I'm writing an essay. I don't do that anymore. What I do now is find stuff off Google and then cite it to peer-reviewed journal articles because I'm lazy. Quality improvement data. That is evidence-based data. And then unverified social media posts. I mean, come on, we're not stupid. Existing clinical guidelines. Okay. Goopy, go away. A nurse demonstrates presence by primarily by completing tasks quickly, maintaining eye contact, active listening, and being with the patient, asking close-ended questions, delegating routine care. Okay, we're all smart here. Yep. Okay, what are the 5 rights of delegation? Okay, think about this. You can delegate a lot of tasks, like how we are gonna have. Get off me! Oh, I'm sorry. Which represents the 5 tasks delegation. Okay. Think about what things can be delegated and what things cannot be delegated. So if you're going to go and give a bath, or you're going to delegate a bath to a nursing student, you want to say, can this nursing student do this? Is it the right task? This one's kind of a toss-up of like which one it is. I'm not really sure. Because Celestia said 2 different things. Is this nursing student the right person for the job? Are they able to give a bath adequately? Are they Zach Armstrong and they're just going to be annoying as fuck about it? Is it the right person? Okay. Right supervision. Is when the nurse watches, are they watching you do it? Did you do it right? Right environment? Okay. You think that one's in there? I don't know. What's the environment? The patient's room? I think we can say no. Right direction and communication. Is the nurse who's giving the instructions able to say, Autumn, go give lady in bed 4 a bath go give her a bath. But what the nurse meant was go give the lady a bath in bed 4 with those heated wipes. But then, the instruction's bad, so Did she give the right directions? Yes. Okay, the total 5: right task, right circumstance, right person, right direction, and right supervision. So right circumstance is, um, did is this patient the right patient for Autumn to give a bath to? You know, are they an active ADRS? Are they, super agitated at the moment? Did they just get intubated and they're all like worked up and freaking out because they have a tube down their throat? Or, what if they're not stable? What if they're like actively dying? Maybe the nurse should be the one to give the bath so they can keep an eye on the patient. Okay, which task should the RN avoid delegating to the UAP? Assisting with a stable patient with bathing, obtaining a routine vital signs on a stable patient, administering oral medication, transporting a patient to X-ray. Okay, which of these things can be done by techs and which of these things cannot? We are barely able to administer oral medication to patients without being so supervised. So a tech is certainly not going to be able to do it. Okay. Documenting a truthful medication error reflects which ethical principle? Okay. This is a reach. But do you guys remember the movie Divergent? And they had the factions, and one of them was Candor. Well, this is how I remember this. Wait, no, it doesn't even start with the same word. Okay, I think I just made that up. Truth-telling is virtue. It's not justice, it's not fidelity, it's not autonomy. Autonomy is making your own choices. Justice is, I'm not really sure, and fidelity is, I'll get back to you on that. Okay. A nurse believes an order is not in the patient's best interest, but is pressured to carry it out. The intense discomfort the nurse feels is best described as burnout, moral distress, compassion fatigue, or role strain. Burnout, I'm too tired. I'm too tired to even deal with this. Okay, I can't even deal with this right now. Role strain, I don't know what that means. Compassion fatigue is I'm so tired that I cannot even be compassionate anymore. Oh, you hurt? Okay, well, you know what? My back hurts. You really tough life out here. Moral distress. I know something is wrong and it doesn't feel right, and I don't feel like I'm acting in this person's best interest, but I have to do it even though I don't feel like it's right. Appropriate strategies when communicating with a hearing impaired patient. Face the patient so he can see your mouth. Speak loudly and quickly. Reduce background noise. Provide extra time to respond. Chew gum to keep your mouth moist. Okay, well, this patient can't hear, or can't hear well. Speak loudly and quickly. I would say speak loudly, but you're also not allowed to yell, so the answer will probably never be speak loudly. Reduce background noise, obviously. Provide extra time to respond. Yeah, so, I ask a question. He's still trying to perceive what I just said because his brain moves slower because, you're trying to hear what I'm saying. Formulate a response, and then I just go, boom, next question. It's kind of an asshole thing to do. A non-English speaking patient needs discharge teaching. The nurse should first ask a bilingual. I don't know, I can't change my headphones to not quiet mode. A non-English speaker is speaking. Okay. A non-English speaking patient needs discharge instructions. The nurse should first ask a bilingual staff member to translate, provide written instructions in English, use a professional medical interpreter, request the patient's adult child to interpret. What's interesting about this, remember this, you never ever ever use a family member for somebody to translate for somebody who doesn't speak English, because they will 9 times out of 10 give you very loose interpretations of what this person is saying. So, what do you rate your 10? Cinco. What does the child say? He said 7. Not me. I know what you just said. He said 5. So, you want to use a professional. Staff member, I mean, I don't really see why not. I guess you would always want to go to the professional first. There's probably some weird reason as to why you can't use a staff member. Well, because maybe they won't know all the medical terms. I'm thinking like a bilingual nurse who's in your unit, but you can't just use like a housekeeper or like a transporter. They're not going to know what the hell they're saying. Which statement is therapeutic? If I were you, I'd agree to surgery. Don't worry, everything will be fine. Tell me more about what scares you most. Let's talk about something else. Come on, we all understand. What are intrinsic fall factors? Intrinsic, we learned this word in natural. How do I get that to go in? Okay, history of a fire fall. Cluttered environment, orthostatic hypotension, diuretic use, infrequent rounding. Okay, well, let's think about this. Intrinsic, that's probably going to be like, think like, what can you not change? What are the things that are like, you can clean up your environment and you can increase the amount of time spent rounding. But, I mean, you can take away the diuretics, but the diuretics are already in use, so, Orthostatic hypertension, also if it's secondary to like a medicine, you can change it, but it's like in your body, Think about like the external and internal. And then a history of falls. Yeah, go external versus internal. You can mess with an environment, you can increase the amount of rounding. Oh, excuse me. I just ate some pizza rolls. No bagel bites, I don't know. Which intervention is universal fall precaution? Keep bed in a high position when resting. Maintain the call light within the patient's reach. Turn off the call night lights to promote sleep. I can't read. Use bed rails on all patients. Use side rails on all patients. Okay, we all know this. The patient's not going to get up if you're in there. Maybe, unless, they're stubborn. Okay. Which restraint order is appropriate? Bilateral wrist restraints, PRN for agitation. Soft wrist restraints for pulling lines, reassess every hour, 24-hour limit. 4-point leather restraints, 72 hours, no reassessment needed. Chemical restraint for staff convenience. Chemical restraint is illegal. 4-point leather restraints for 72 hours. Okay, that's already, boom, that's wrong, way too long. No reassessment needed. That is your 100% identifier that this is wrong. You always have to reassess, usually I forget exactly what my thing said, but I think it's every 2 hours you have to reassess. And then, obviously, restraints cannot be PRN. Soft wrist restraints for pulling lines, reassess every hour, 24-hour limit. That is your correct answer. Okay, we're almost done-ish. Which component of restraint care must be performed by the RN and not delegated? This question has 2 correct answers, but it says that there's only 1 correct answer. Applying the restraint device, assisting with hygiene, assessing for restraints and evaluating behavior, routine circulation checks. Okay, the answer that it says is assessing need for restraints and evaluating behavior. Obviously, a tech cannot say this person needs restraints. I mean, maybe they can say, oh, this person's pulling their tubes out or they're about to self-extubate and whatever, but they have to tell the nurse who's going to then assess and be like, oh shit, yeah, we totally need restraints. Let's go put an order in. Here's a caveat. Only nurses can do circulation checks. Like, I don't think techs can't do circulation checks. They can't make sure that that's still okay because that's assessing. So this question's written wrong. Just know pretty much only nurses can assess. Okay, covering a cough and disposing of a tissue in a closed bin primarily interrupts which link of the chain of infection? Portal of entry, reservoir, mode of transmission, susceptible host. Portal of entry is how they get in. Reservoir is where they live. Mode of transmission is how they get out. And susceptible host is who they infect. So, cough and you throw it away, you have disrupted their mode of transmission. Okay, influenza. Did we have a TB question? Oh, I swear to God we did. I guess I didn't actually have it. For a patient with influenza, which precaution should you do? Okay, flu. It's a virus. We know that. Protective, positive pressure, contact, droplet with a mask, 3 to 6 feet, or airborne with an N95. Well, we all know how flu is spread through coughing, sneezing, spitting. Does it hang in the air? Do you have to have a negative pressure room and keep the air inside when you have someone with flu? Or is it a droplet? That's right, it's a droplet. Can you, like, actually fuck off? Get down. He wants to be fed so bad. They don't get fed for an hour. Okay. A fire starts in a patient room. What is their correct order? Rescue, alarm, contain, evaluate. Clearly, it says RACE. RACE. Rescue, get the patient out, pull the alarm, use the thing and try to contain the fire. If you can't, and then evacuate, or if you do, still evacuate. Okay, when using a fire extinguisher, where should the nurse aim? At the flames, at the smoke, at the base of the fire, above the fire. Okay. I mean, obviously the base. I don't think I don't need to explain that. Okay, a new nurse relies on rules and perceived answers as right or wrong only. This relies on rules and perceives answers as right or wrong only. This reflects which level of critical thinking? A new nurse. You're basic. Ugg boots and PSLs. Dude, that is so old. I don't actually think you guys know what that will be. What that means. Yes, you do. You're not that much younger than me. A primary purpose of nursing process. This one threw me for a loop. The primary purpose of a nursing process is to diagnose and treat disease, diagnose and treat human responses to health problems, provide medical orders to the team, replace provider decision making. Okay. We know these are two wrong. I mean, yes, you provide medical orders to get the provider to give you orders, but not really. Replace provider decision making? No. More like influence. You can influence it. Nurses can't diagnose disease, but they can diagnose some things. Like, they can treat pain, they can diagnose risks, or more like the nursing diagnosis is, and then, provide like education. So diagnose and treat human responses to health problems. So it's not disease, it's health problems. Maybe it comes from a disease, but someone with pneumonia cannot breathe, so they need O2 therapy. Okay, during which phase of the nursing interview should the nurse summarize findings, explain next steps? Orientation, working, termination, planning. It's termination. They are listening to the patient, they're summarizing what the patient said, and they are educating on the next step. Which are back channel or probing techniques Go on. Tell me more about that. Okay. All right seems like it would end the conversation, but this says all right is in there. ABD. Abdominal. I don't really agree. I feel like all right kind of is like closed, you know? But maybe not, maybe not. And then obviously, think about it. This is a leading question. You have pain, right? Oh, well, I wasn't even thinking about pain. But yeah, I have pain. Why did you do that? Okay, if a nurse said that to me, I'd be pissed. Okay, good job, everyone.